hope you're really going to enjoy the session that we've got for you this afternoon. I've come along to talk about, myself personally, about research career opportunities for nurses, midwives, and the wider allied health professions. So that's all professions other than medicine and dentistry. I have actually got some wonderful colleagues here who are going to talk a little bit about their experience of research, their research career journey, but also tell you about the research that they're currently involved in. And hopefully will provide an entertaining and interesting end to what has been a really interesting day. So I thought I would start off with talking about why we want to be doing research in the first place. And I've shamelessly borrowed or plagiarised the Chief Nursing Officer's research strategy for nurses. And the dotted dots are where I've taken out the word nurse. You will notice, the eagle-eyed ones of you will notice that I have missed one out and there is a nurse in there still. But the reason that I've done that is that I thought the 5 themes that are here within this nursing research strategy is highly relevant to all healthcare professionals who work in the NHS and health and social care. And that actually it really does demonstrate why it is that we need to be trying to embed research in everyday clinical care. Aligning research with public need, releasing research potential and creating that climate in which healthcare professionals can contribute to research in the whole range of roles that are available in clinical practice, building the best system and investing in our future research leaders. And that's really what I want to talk to you about today. My career in healthcare and in healthcare research has been a bit like snakes and ladders. That's why I have put that up here. And I would say that when I speak to many of my colleagues, their experience of getting involved in research has been a bit like snakes and ladders. And it shouldn't really be like that. What we need to do is provide support and structure for people to actually be able to contribute to research in healthcare practice. And without that, we are never ever going to be able to change the culture of research in practice. At the moment, I would say that people are talking about research, and that is a really good thing. But actually, research is often still seen as something that is nice to have, but not essential. And I would really like to challenge that. I really want people to understand and know how essential it is that research is threaded through everything that everybody does in modern healthcare practice. So I've just put this slide up because I thought you might be interested to know. This is the NHS workforce figures, and this is the latest data that's available, which goes right up to June 2023. These are the numbers of registered healthcare practitioners who work in the NHS in England. There are 1.5 million people who work in the NHS, and of them you will see that actually over 500,000 people are nurses, midwives and allied health professions. And within those groups, very few are actually engaged in, involved in, or most importantly, leading research. They are not leading research. And if you think that that massive contribution to the workforce, these are the people who are seeing patients day in, day out, who interact with families, who interact with other people. This is a massive missed opportunity in terms of embedding research as a culture within all our healthcare systems. If we don't get it right in terms of including the whole workforce in research, then we are not going to be able to contribute to improving outcomes for our population. Now, through the talks that we've had this morning, we've had some really great ones, and I thought a bit about the themes of some of those. So I was thinking about this idea of being sustainable and about sustainable healthcare. And in the 39 years of healthcare practice that I've experienced, I would say that there still is a kind of culture in the NHS of instant results and not really thinking about what is going to be best for a longer term outcome. So working sustainably also means about thinking about what you need in terms of your workforce infrastructure, but it also means about acting wisely to invest in research, and that is a big problem because it isn't widely invested in. Thankfully with the HRP and with some of the changes that have happened more recently, that is starting to occur. But generally speaking, there is a little investment, and particularly little investment for nurses, midwives and HPs. I'd also say that there is massive inequality across the group. So some health professions do better than others, and what we want to do is try and ensure that we actually make an equitable and accessible service for everybody. So I just wanted to talk to you a little bit about some of the research roles that might be available for people in practice. Now, today we've been talking predominantly about clinical academic roles and about the kind of roles where you might be in research leadership. However, research is something that can be spread across the whole research continuum and in all spheres of clinical practice. And the NHS is really keen to try and embed research in roles across all spheres of clinical practice. So if we look at clinical practice roles, we can think about what it is that our core practitioners are doing in terms of research. How can they get involved and engaged in increasing opportunities for patients to access research? What can our specialist nurses, midwives and HPs, our advanced practice professionals and our consultant practitioners, what can they do in terms of getting involved and leading research? And I think some of the conversations that we've had have been about the challenges of accessing people and getting to people. And Carolina very nicely explained that in everyday healthcare practice, all these people are there, they're in practice, and the healthcare practitioners are the people that are in the front line and are seeing these people every day. So the other roles in practice that I don't also want to miss out are the clinical research delivery roles. So I think people often shy away from research, and particularly if they are not interested in going down a kind of clinical academic route or researcher route, they may feel that research is not for them. But there are many roles in clinical research delivery which actually nurses, midwives, HPs and the wider community can get involved in. And that includes getting involved as practitioners, enhanced roles, principal investigators, associate investigators, all those kind of schemes that are available for people to actually interact with research. I'm very happy to say that the NIHR has recognised that there is a massive inequity in terms of engagement of non-medical health professionals in research. And they have recently announced extra funding, an extra £30 million a year for 5 years, to actually support new opportunities for non-medical health professionals to become engaged and involved in research, and for some of them to become our research leaders of the future. It's really important that we get those research leaders from practice, because those people in practice are the people that are asking the questions about things that are happening now, today, every day. And as somebody alluded to earlier, actually what you don't want is research that is conducted and takes so long to come to fruition that actually by the time it gets to clinical practice it's not relevant, or that it's not asking the right questions, or that it's not actually accessible for people because of the design of the study and the way that it's developed. So NIHR has a clinical academic pathway, which is this pink kind of row, which is specifically for non-medical health professionals. And they have introduced a couple of new items on here, which are really exciting. I would also like to point out that the new items, which have got their nice little new banner, are actually also open to medics too. They're not just for nurses, midwives and HPs, they're also for medical health professionals to access also. Although I'm glad to say they will give priority to underserved groups, which happen to be nurses, midwives and HPs. So yes, so that's a good thing, isn't it? So currently, there are opportunities for people to follow routes in terms of practice, and there are new roles that have come out to help support people. So the Pre-Application Support Fund, for example, is a new award which has actually just been released in its first round, and is specifically to help people to get into some of those other programs, so into the pre-doctoral fellowship and into the doctoral fellowships. And there's a new senior clinical and practitioner academic fellowship, which is specifically for healthcare professionals who have just completed a PhD and to help them establish their research career. So some really exciting things happening in the NIHR frame, but also lots of things happening in the wider network in terms of engaging healthcare professionals. So I'm going to pass over to my colleagues who are all waiting. And we have actually got 5 fantastic presentations here from a range of people who have followed different career pathways and are leading research in different specialities. So without further ado, I will hand over to the very first of them. Rich Holmes is going to come and talk about his research and his doctoral fellowship.